sometimes things can happen like arthritis, stenosis, surgeries that change the actual mechanics of your spine. So those are the things where then you have to learn to move just a little bit differently so that you're not jamming those joints back together again and they're not creating chronic inflammation from that constant bombardment of pressure. So some of those activities includes just keeping your body just active and flexible naturally. So we talked about walking being natural mobilization for your back and your hips. That's something that a person can do throughout their lifetime. Now the time that you can walk often varies based on your symptoms. You know, we don't want to be pushing ourselves because sometimes that happens, right? We all start exercising or we start living our life and we have our list of 6 things we need to get done, or the workout that we want to get done, or hey, that golf game that I said I'd sign up for later this afternoon, you know, those things start to kind of compile, and then your body again may have something to say about that was too much. So those are the things where oftentimes when a person's actually actively recovering from an injury, I'm like, take that list of 6 things and try to cut it down into 2 or 3 things. Some of the ways that we harm our body is the way both of us are sitting right now, you know? We're creatures of habit, right? I mean, we all have that one way we like to sit. You know, if it's the right leg crossed over the left or the left leg crossed over the right, it creates actual shifts in our pelvis. So if this leg is crossed over this leg, it overstretches my left side and actually it kind of kinks or closes the right side. It drops this shoulder elevates, then my neck shifts because we have a reflex that says this is where our head's supposed to be. So we're not just talking about low back here, this is also how you can protect your neck and your upper back. So I know you guys have done this demonstration before, but oftentimes when a person is sitting in a chair, I ask them to slouch and to arch their low back. And what happens up here? What happened to my upper body when I arched my low back? When I was here and then arched my low back. Yep, it straightens up. So now if you're to try this in your chair right now where you're slouched, and then you try to fix your posture up here without moving your lower back, can you do it?
Yeah.
Yeah, there's too much pressure. When you're here and you don't move your lower back, there's nothing to correct up here. You're stuck like this. And that's what happens sometimes, you know. Sometimes patients come to us after a major illness where they spent a lot of time sitting in a chair or laying in a bed, propped on pillows, recovering. Their body is basically C-shaped and all these muscles in the front structures have gotten tight. Now all of a sudden their body can't come out of that position. So how we sit plays a large role into how we feel in our low back, and also how tight these muscles will get. You know, we talked about the tightness of these muscles, but also muscles that help our body to go up and down stairs, to walk up a hill, to push ourselves and propel ourselves out of a lower chair or a lower couch or seat. Those are your butt muscles, your quads, and then we have to balance with our calves and our feet. And also, if we're here, all the muscles in back here get overstretched and weak. All the muscles in front get tight and short and stronger groups than these ones back here. So then our body also all of a sudden has this X-shaped pattern where we have patterns of tightness and too much restriction in the front, but then we have the cross pattern of it's too short or too overstretched and too weak in the back to provide that push or that structure for our body to move off of. Thanks for watching our back education class. If you have any questions or comments, please call us at 269-968-0888, or you can contact us on our Facebook page.